Hello, this is Dr. Michael Shear with Learn LODI, a free resource on how to market, treatment plan, place, and maintain locator overdenture implants. The purpose of this YouTube video is to describe the maintenance and care of your locator overdentures, and specifically focusing upon the locator attachment within the implant inside of our patient. We will be touching briefly also upon maintenance of the nylon insert. However, there are other videos referencing how to maintain these individual attachments. The first step is to remove your locator overdenture and to carefully inspect the nylon inserts on the intaglio surface. We are looking for any areas of bent nylon, worn edges, or discolored areas in the center. All of these things can indicate to us that we could potentially be in the need of a nylon replacement. The second step is to go ahead and inspect your locator attachments. In this case, this is a 4-implant LODI overdenture case where we place them in the anterior mandible. We're going to go ahead and inspect for any areas of plaque very carefully by using an air-water syringe, by rinsing off and then subsequently drying the locator attachments. This will help bring out any areas of plaque accumulation that would become more visible with careful air drying. After air drying, you might notice a layer of calculus in addition to plaque accumulation both on the surface and on the inside of the locator. To remove this, I recommend using a plastic instrument such as the one shown here in a side-to-side motion, and then also a very careful interior motion of the interior portion of the locator attachment. I don't recommend using any sort of metal instrument like a titanium or stainless steel scaler. This will scratch the surface of the locator. You can use a dental explorer instrument with a careful motion. This will also help clean off the surface of the locator. One additional series of instruments, while it seems silly, is very effective at cleaning the surface of the locator attachment. And that's something as simple as what you see here, which is a cotton tip applicator in a gentle rubbing motion side to side. In addition, you can use things like a cotton roll, also indicated here. And this is something that I incorporate with patient education. I go ahead and I give my patients a few of these cotton rolls, or you can simply tell them to go down to Walgreens, CVS, or any sort of drugstore and get a 2x2 gauze. Just careful side-to-side motion and clockwise, counterclockwise motion will really help the patient as well as you in the clinical chair or your hygienist to clean the surface of the locator from plaque accumulation and debris. One additional instrument that really helps is to educate the patient with a toothbrush. A simple soft-ended toothbrush such as this Access Oral Care toothbrush, which just happens to have this kind of inverted appearance where it will allow the patient to clean the sides and the underneath portion of the LODI or the locator attachment. As demonstrated here, what's really nice about the locator attachment is it is relatively maintenance-free, especially when it comes to hygiene purposes. Anytime that I can have the opportunity where myself or my hygienist has the ability to clean the locator attachment in addition to providing patient interactive education is really critical. And many times during the hygiene and maintenance procedure of the LODI case or the locator overdenture, we will be having a mirror visible for the patient so that way they can visualize how we are cleaning the locator, so it will help them improve their home technique as well. And it's really critical to do that because what the patient does at home is ultimately the most important part. So now at this point what we're going to do is zoom out a little bit and focus on a little bit more of the technical cleaning side of the locator attachment, some pearls and tips and tricks. After careful air drying, and as we can see there's still a little bit of plaque accumulation to get cleaned up, we can take an explorer instrument and more or less rub on the inside portion of the locator and then also to localize some individual components of the locator. An explorer is a safe instrument to use with the titanium nitride coating. We're just going to be feeling if we feel any visible areas of heavy calculus accumulation. We're going to put down our Explorer for just a moment just to look at the integrity of the soft tissues as well as the implant attachment and the implants themselves. I don't recommend probing heavily around any sort of implant, but what I like to do is just to touch the edges of the soft tissue around the LODI implant just to make sure that there's no separation or purulence. Additionally, I like to verify that the locator attachment and the LODI implant is solid without any sort of mobility by using the backside of two dental instruments. Now at this point we're going to pick up our Explorer again and use it to clean the inside portion of the locator in greater depth and detail. I like to take my Explorer just to feel the rim on the inside portion of the receptacle and of the locator attachment, feeling for any areas of calculus accumulation and hard material. Also important to note that there are vent holes, also known as a weep hole, on the side portion of the locator attachment that must be cleaned and thoroughly cleaned out so it would allow liquid and hydraulic forces to push liquid out of the interior portion of the locator attachment. It's a little difficult to see from a frontal view, so let's go ahead and use this occlusal mirror to help visualize exactly what I'm talking about. As you can see here from the occlusal direction, we have the four LODI implants with the locator attachments, and if you look carefully on the sides, there's a little bit of calculus accumulation from where I tried to take my Explorer to push internally. As you see here, what I do recommend is taking the Explorer instrument and cleaning out that vent or weep hole. I do find a lot of times in my own clinical practice that some retention issues of the locator nylon insert can be cleared up with cleaning out this vent hole. The best way to clean out this vent hole area or this weep hole is to go ahead and just use a simple dental Explorer. And it can be kind of tricky because many times this is an easy place for a patient to get calculus accumulation. We have our patient here with pretty good oral care, oral hygiene at home, and still yet he has a significant amount of calculus within that weep hole. Each locator attachment has it. Some are easier to clean out than others. I just simply tell my patient at this point that I'm going to be tracing around the edges of your little clips, and these little areas are important to keep clean. Many times I do also show this to my patient so that way when they direct their cleaning, they can also get inside of there. The most difficult area to keep clean is that weep hole, and really the only way to properly keep that kept clean at home is with the use of a water pick or water jet spray device. And that Explorer I'm using in a very careful fashion, not putting too much pressure on this superior or outside portion of the locator. That you can do with a plastic instrument as mentioned before, because this instrument will not scratch the surface of the locator. On the sides I'm using it on a side-to-side fashion, and on the interior portion of the locator I'm using it in a circular and figure 8 motion. The key here is not to put too much force on the interior portion of the locator, because you can also break the plastic instrument with too much force. And as previously mentioned, I'm going to be showing you from the occlusal direction of using a 2x2 cotton roll or cotton tip applicator to help facilitate surface cleaning of the locator. Also, at various points through the cleaning procedure, I will educate my patient on the use of a water jet or water pick device to help clean the interior portion of the locator. I really like to use them for this purpose because the patient is able to go ahead and easily wash away the interior portion of the locator. I recommend the simple straight spray tip or the orthodontic appliance brush tip to help clean the interior portion of this. I'm not showing that on this video simply because of the amount of water. It would be difficult to videotape us using that as a demonstration. Now, once we are satisfied with the overall cleanliness appearance of the locator, I do like to show that to the patient because this is the gauge. We want them to come in like this every time. We're going to then reseat the locator overdenture on top of the implants, very carefully adapting it. I like to do that even though the patient would want to help me with this. I like to verify that my overdenture snaps into place and I have sufficient retention and hold in a passive direction. I want to feel side-to-side motions as well, verifying that each one of the nylon inserts is holding. I like to take a series of fingers in a side-to-side as well as anterior-posterior motion, verifying that while I have a little bit of movement with the semi-resilient design of the locator, I don't have an excessive amount of movement. An excessive amount of movement would indicate to me that I would have to consider a reline procedure to verify that the soft tissue is completely adapted to the intaglio surface of the denture. I like to remove the overdenture one more time just to inspect the nylon inserts and verify that any bending or wear has not occurred during the try-in period. It's important to also educate the patient on how this is supposed to look. This has been maintenance and care of locator overdentures on the Learn LODI channel. My name is Dr. Michael Shear. I hope you've picked up a couple of tips and tricks along the way here. Make sure that you tune into other Learn LODI videos and stay tuned for further information related to LODI overdentures.